It's vital to have naloxone and know how to use it. Naloxone is sometimes referred to by the brand name Narcan and may be called the overdose drug. For someone overdosing on opioids, it can mean the difference between life and death. This medicine immediately reverses the effects of an opioid overdose. Sometimes the reversal is temporary, so naloxone may need to be administered more than once. With the alarming increase of fentanyl-related overdoses, it's more important than ever to have naloxone on hand and be able to use it quickly and effectively. Fentanyl is a highly potent opioid medication that can be fatal even in extremely small doses. It's frequently added to substances purchased illegally on the street, and many contaminated pills look like legitimate pharmaceuticals. That's why it's important to keep in mind that anyone using any non-prescribed substance is at increased risk of an opioid overdose. So first, let's walk through when and how to use naloxone. Then I'll explain how you can get a prescription. If someone is experiencing signs of opioid overdose, administer naloxone immediately. One of the major signs is unresponsiveness to loud shouting or direct pressure on the chest. Other signs include very slow breathing or no breathing at all, snoring or gurgling sounds while breathing, blue lips or fingernails, and pinpoint pupils. Naloxone is administered through the nose. Your naloxone kit may contain one of two main types of applicators, either fully assembled and ready to go, or one that needs assembly first. Be sure to practice assembling it before you have to actually use it. Once you've assembled an applicator, you insert the tip into the person's nostril and spray. It's important to know that the person who receives naloxone may experience opioid withdrawal when they awaken. This can include symptoms such as irritability, shaking or tremors, vomiting, diarrhea, loss of bowel control, hot and cold flashes, and aches and pains in muscles and joints. The effects of naloxone could last 30 to 90 minutes. All these symptoms are temporary, but can be very distressing. The beneficial effects of naloxone are also temporary. The overdose could recur if the opioid in the person's system outlasts the naloxone you administered. This means that anyone who has overdosed and received naloxone still must be taken to an emergency room for observation and possible readministration of more naloxone. To recap, in the event of a suspected opioid overdose, administer naloxone and call 911. If the person is still experiencing signs of overdose after 2 to 3 minutes, administer naloxone again. Now that you know how simple it is to administer naloxone, I want to tell you how to get it. Step 1, find a naloxone provider. This may be a physician or other prescriber, a pharmacist, or a clinic. Naloxone is now available in every state, even without a prescription. You may wonder which brand or dosage of naloxone is best. My answer is this. All naloxone kits can save lives. It doesn't matter which one you get, as long as you get one. Step 2, make sure everyone in the household, including your child with the substance use disorder, knows how to identify an overdose and how to use naloxone. There is always a chance that someone else in the home may accidentally overdose on opioids. Someone might confuse one pill for another. A young child could ingest opioids by mistake. Sharing that reality and discussing your honest, serious concerns could have a positive impact on your child. This conversation may feel awkward or uncomfortable, but using a neutral, non-judgmental approach can help. Think about how you might discuss using an EpiPen if someone in the family had a severe allergy. Focus on correct use of the tool rather than on the child's drug use. And make sure everyone knows where the naloxone is stored. Let's summarize what we've covered. There are 4 things you need to do to be ready to save a life with naloxone. Identify a naloxone provider, locate a pharmacy where you can buy it, and/or find a clinic where you can obtain it free of charge. Make sure everyone in the household knows how to obtain naloxone and where to find it in your home. Learn how to use the medication yourself. Teach everyone in the household how to identify an overdose and how to use naloxone. Again, if you have a child who has a substance use disorder, I strongly encourage you to get naloxone for your household. Having naloxone in your home can be the difference between life and death.